The North Carolina Telehealth Network Association, NCTNA, is a dynamic, member-led nonprofit that works to connect and empower North Carolina's public and nonprofit healthcare providers with medical-grade broadband connectivity services via its relationship with MCNC.
We believe that broadband is the infrastructure of opportunity because healthcare is opportunity for rural residents in North Carolina. Healthcare provides the opportunity to thrive where you're born and to not have to move to deliver a baby, to not have to go inland for 3 months before your due date from Ocracoke for maternal care. Opportunity means building where your roots are. Healthcare providers as a whole across the nation are navigating very fragmented landscapes when it comes to IT, operations, grants, funding, support. NCTNA marries all of that and brings it all together with the help of MCNC. We bring together custom network solutions with expert navigation of federal funding in one place. I think the most important thing that made MCNC the right partner is our shared mission to serve and prioritize anchor institutions across the state. The technical aspects of the network are incredible and unique to our statewide backbone here in North Carolina. And just the nature of being a research education network alone is incredible. MCNC will always be there to prioritize the anchors who are the heartbeat of North Carolina.
I think in a lot of ways, our partnership is healthcare in North Carolina, from Murphy to Manio, spanning over 50 healthcare organizations, which lead to 700 plus endpoint sites that we're serving. I mean, that's really shaping the backbone of healthcare in our state. I think with the unique challenges that North Carolina faces with our geography, our limited access to care, but our incredible education institutions and healthcare systems we have here, together we allow access to happen in rural areas to healthcare. I think a lot of times when we talk about the digital divide, we think about to the patient or to the home, to the resident, to the business. But we found that critical healthcare institutions try to run healthcare operations on worse than hotel lobby Wi-Fi, worse than we have in our homes. So for us, our piece of addressing the digital divide is addressing that foundational first layer, which is the provider to the provider. And that also really allows the big hospitals and the specialty providers that work there to telehealth into another provider at a small clinic. We're the North Carolina Telehealth Network because we are the connection between healthcare sites in North Carolina. And through that, I feel that we're building bridges that address the digital divide. I think I'm motivated by my own experience as a North Carolinian trying to access care. Growing up, we lived below the poverty line in a very urban, well-resourced area, but we still lacked the opportunity needed. And then afterwards, my parents, still in a similar situation, moved to very rural Western North Carolina with my disabled younger brother. And seeing that they faced the same disparities there as we faced in a very urban, central North Carolina area made me realize that so much of it was dependent upon the infrastructure, because in both places we lacked access to connectivity. I feel most excited about the future of healthcare in North Carolina because I think we are so uniquely positioned, almost more so than any other state, because of our research education network and their support. MCNC is always helping NCTNA do what's best for the patient, what's best for the provider, and not what's best for the bottom dollar.
Connected healthcare looks like access to care no matter where patients live and no matter where providers are. And that's really what we're building together in this partnership between MCNC and NCTNA.